I've struggled with this my whole life. Just made me so insecure and life-changing. Thank you, Dr. Lebowitz.
Good morning, Dr. Lebowitz, Long Island Gynecomastia Center, Long Island, New York. So we're starting our week, 2 cases of Vaser, high definition, Power X lipo with gland removal and J plasma. First case, a young man from Pennsylvania, came in from Pennsylvania. He's 39, and he's got some pseudo-gynecomastia. This is fat, but he's not fat. He's kind of a regular, middle-aged type of looking guy. Can he build more muscle and cut some carbs to define himself better? Absolutely, we all can. But this really bothers him. He's had it since childhood. But he really doesn't have that much fat. He's got a hint of a six-pack. I will correct that. Give him the midline right here, the linea alba. Give him the semilunaris lines and etch the six-pack, which I'm going to draw in a second, and I'll show you. Go down to the maximum point of indentation, scoop all the way down to his belly button, stealth incisions in his belly button, by the edge of the nipple, and in the armpit here, to really define the lateral inferior aspect of his pectoralis major muscle, the lats back here and everything. Even the deltopectoral groove will get, he's got a tattoo here, so that's being covered. Obviously he wanted me to cover that, and he was gracious enough to give us consent for the video. He's got some gland in there, but it's going to be fibrofatty because he's in his 40s and is probably his testosterone level is a little bit less than it was when he was younger. So the gland isn't bombarded with testosterone. So it's going to be kind of fibrofatty, which is good, meaning that I can make a teeny incision in there and not have much of an incision on there because his areolas are not that big. So I'm going to mark them, numb them, and join me in the OR. So here's the markings. That's a transition zone. I don't want to go anything above here because I want to maintain some bulk here. But from here down, that's the kind of where everything is that he bothers about. Come down, and I want to really, this hatch mark down here, really get him nicely. So I want to maintain some volume up on top. All this stuff, really kind of get this out, make a nice semilunaris right here, really kind of get that down. Of course, the midline there and down over here, and deltopectoral groove, stealth incisions in the armpit here by the side of the nipple, and one inside the belly button, and of course the six-pack, 1, 2, 3, 4, 5, 6. So he's going to be all fit and nice. Down over here he'll work on, and if he ever wants to come back later, we do an incision here, and 1 or 2 in the back there, we can get that, but that he can work on. But really, most guys are concerned and worried about this. This is really my specialty. So I'm going to numb them and join me in the OR. So we pump you up.
Pump you up.
Here we go. He's numbed. If you feel anything, just let me know. Give you more very easy. So I'm really concentrating first on the gland. So spending more time so I get under it, which I am. So you can see me superficial right there on top of the gland. Just like that. And then get under that and just kind of whittle it away as we do it. We suck you out.
Suck you out.
So I'm getting this to the top of the six-pack here. Getting that nice and whittled down. Watch this. It's like Groundhog Day.
How long did it
It's like Groundhog Day. So what I'm doing now is I'm etching this lateral aspect, defining of the pectoralis major muscle. I got some curved cannulas, giving them some direction. Skin tightening, J Plasma. You want this, you come to me. You don't want this, no come to me. Watch, look at that. That's on fire. That's hot. All right, so Dr. Lebowitz, Long Island Gynecomastia Center. Here we go. A couple hours later, high definition, 4-dimensional chest body contouring. I go over and above just regular gynecomastia work. So if you just want the chest done, literally go to somebody else. If you want, I'm covering his tattoos with this tape, but you want the deltopectoral groove, you want this squared off excellent shape, stealth incisions, this semilunaris down to the lats. Look at those lats perfectly. This, the linea alba, named after Jessica Alba. No, it's not. See that there, and see the 6-pack, 2, 4, 6, all the way down here. This great shape, the indentation from the midline, great shape to his rectus abdominal muscle, the great squared off shape here, full definition of the chest. We don't want him to look like he's 10. We want some muscle action here, and he's going to build up some muscle, but he's going to look amazing. So this is the work I do. I'm more expensive, but this is what you get. We got over 2 liters of fat out here, over 2 liters of fat, and he's not a little guy. So getting 2 liters of fat are amazing.
Not a big guy.
What's that?
He's not a big guy.
He's not a big guy. Sorry about that. He's not a big guy. He's a little guy, actually. But we got 2 liters of fat, and these are the glands. If you come over here, these are the glands that we whittle down, so the incisions on his nipples are very, very small. And you got to remove these, otherwise the nipples maintain little puffy nipples. But this is what you get from the belly button up to the shoulders, the deltoids, the rectus abdominal muscle, the glands out, all to the chest. I even went to his back here, went under, went to his back. Actually, do like a bridge. You see that? Look underneath here. I even scooped them up way over here. So, gynecomastia, you call me, Dr. Lebowitz, 631-424-0101, 631-424-0101, or email me, jonathanlebowitzmd@gmail.com. Garrison, who's the best videographer in the world, will put that on. And there you go. Hope to see you soon, and thank you for considering me for your exquisite, superb gynecomastia needs. Thanks. Bye-bye.